The Lung Health Check programme is part of the largest investment in lung cancer in Ireland's history. And this is only possible because of the funds and fundraising that occurs from people around the country, particularly on Daffodil Day. One of the big benefits of this partnership is how our services and supports in the Irish Cancer Society are integrated within the pathways of a cancer diagnosis for all patients within Beaumont Hospital.
The most important thing is to try and identify people who have lung cancer as early as possible, and that's been the key benefit of this Lung Health Check pilot study. So we're identifying patients who have very early stage lung cancer and giving them the best chance of cure, which is with an operation.
I've got a phone call from a nurse from the Beaumont lung unit, I think it was, and she invited me to go along to have a screen test done. So I didn't think I had any issues. I didn't think I had any health problems whatsoever. And suddenly I realised, well, actually there is something wrong with me. So I was glad to hear and be informed of it. Well, I thought it was a fantastic experience. I've not been to hospital or hospitalised as such in the past, so I was a bit apprehensive about the whole thing, but it turned out to be fantastic. People were fantastic. They reassured me and everything, led me along the way, and I just delighted. It was fantastic.
The uptake has been phenomenal, and we're seeing the results in patients who are having their curative operations already. So we're incredibly proud of the work that we're doing in Beaumont RCSI with our colleagues in Our Lady of Lourdes in Drogheda and our surgical partners in St. James's. We feel the project has been a huge success, and we hope that it will inform a future lung cancer screening programme for Ireland. The demand has been through the roof. Our participation rates are between 70% and 80%, which is higher than most international pilots, and just reflects the demand that there is out there for lung cancer screening in Ireland. So we've been incredibly impressed by that, and incredibly impressed by the engagement with the patients and the participants. The benefits are manifold. You know, the lung cancer mortality rates will reduce by at least 20% in the country, and it will become very economically viable as well, because we can show that as well, that when lung cancer screening is done correctly and done at the population at large, we can, as well as reducing mortality, we can reduce overall health costs as well to make it very viable for a programme at large. And that's what we're trying to achieve with this pilot, and I think we're well on the way to do that.